Welcome to Dr. Dana Show. Today we have an amazing guest on today, Dr. Lita Lindell, who is a past eye surgeon. She has had a med-spa doing plastic surgery, and now she's gone into functional medicine and anti-aging medicine, longevity medicine. So we really want to hear, how did you make the transition? Was there a moment in your life that was a pivotal change and you had to change your life, or how did that happen? And then go into your career, and what do you see for the future?
It's a pleasure to be here, Dr. Dana. Indeed had a pivotal moment, and it was the universe telling me that I had to change my ways. I had a private practice in cataract surgery in Palm Harbor, Florida. Okay. And I'm kind of ADD. I'm always learning, always adding things on. I also had a med spa where I did plastic surgery. I was teaching transconjunctival blepharoplasties.
What's that? What is it? Eye, something about the eye.
Yeah, I did upper lid lifts.
Okay.
And removing the bags from the lower lids through the conjunctiva, through the inner part with laser, and then tightening the skin with laser, okay, and then tightening the whole face. But I was teaching cataract surgery. I was on the panel for Botox before it came out. Mm-hmm. Very, very busy. And I loved windsurfing. Really? That was my passion.
Tell me about, how do you do that? I mean, I've seen, I don't know.
Well, it's not easy.
No boats pulling you, right? It's the wind doing it?
No, it's just the wind, okay, so there's no motor sound. Okay. But windsurfing was popular. This was the 80s. And so you're on a board with a sail.
It's a big sail, right?
Big sail. And the size of the sail depends on the speed of the wind.
Yeah, you can get taken out to sea if you're not careful, right?
Oh, yeah, and actually I would go to Maui, Aruba,
really?
Hood River.
Did you go over any waves or anything?
Oh, yeah, and get some air. Jump,
you?
Yeah, me.
Oh, wow, you're a tough one.
No, I built a home at home, which was very close to my office, but I windsurfed off my home on the Gulf Coast. I was in a race, actually, a windsurfing race in Aruba. I shouldn't have done that. It was my first race, really, and I thought I was doing so great, and I went to get my equipment, and they didn't have the right sail for me. They didn't have a life preserver for me. Everything was saying, well, maybe you shouldn't do this, and they put men and women together in this race for the first time. I did one heat, it was fine. I did the second one, and all of a sudden, I fell and then got up, and all of a sudden, I'm flying one way, and 5 men are coming towards me. And, you go around 25 miles an hour. Windsurfing was fast. The winds were really strong then. And I collided with the guy that was winning. And we kind of tried to avoid each other, but everything happened so quickly. The boards broke. The sails broke.
They hit that hard?
It was like having a car collision without the benefit of a car protecting you.
Right.
And I had a harness on. The harness tore off of me and basically, compressed me, and I wound up having 3 pelvic fractures.
Oh, my goodness. And did you end up in the water?
I was in the water.
With the fractures after the accident?
I was in the water. The guy that ran into me was in the water. He happened to be Pappy, who had cataracts and didn't really see me that well.
Oh, my goodness.
And they had the Dutch Marines helping out for this race. They dragged us into their boats and took us to shore, and I couldn't...
With the pelvic fractures, they were just dragging you?
It hurt.
I
bet. They put me in the boat and got me to shore, and I couldn't stand. So they put both of us on ice on the water, near the water. They said, well, you should go to the hospital. And I said, no, I'm not going to the hospital in Aruba. Just take me to my condo. And I didn't go.
What'd you do?
I went to the room, and I just kind of spent the night there. I was leaving the next day.
A lot of pain, huh?
It was a lot of pain.
Must have been.
But
tough, man.
But I just...
But you come from a communist country, right?
But when you're the patient, you don't realize, I don't know, a doctor shouldn't be their own doctor.
Strong like bull.
Yeah, well, in retrospect, it wasn't a good idea, but I didn't go to the hospital. Okay. And actually, Pappy found me the next day and brought crutches to the room. And I went home, first class, thank God, in a wheelchair because I couldn't walk. And I thought it was soft tissue. I really didn't think it was that bad.
So there was actually bones or fractures?
I fractured 3 bones in my pelvis, yeah. But I didn't know it at the time.
Right.
And so I got home, my friend picked me up, I had MRI done, but it wasn't red right away. And then Monday, I actually saw my patients. I saw 60 patients in my office.
Incredible.
And I didn't move from room to room. They brought the patients into a room. Yeah. And at the end of the day, I went to my orthopedic surgeon who did an x-ray, saw the MRI. He goes, and he was a friend of mine. He goes, Lyda, what did you do to yourself? And my leg I had lost so much blood, it was actually black. And I had to see the trauma surgeon in St. Pete. And it changed my life because I really couldn't continue. I was at the height of my practice. I had, 13 surgeries scheduled in 2 days. Yep. I had patients scheduled every day. And I found some colleagues that helped me. Yeah. But I was in a wheelchair and for 2 months. Good. But it really did change my life. It made me very humble because when 4 weeks after that, I went to a Botox meeting. Mm-hmm. I actually flew to Colorado in a wheelchair. And just when I traveled in a wheelchair, I realized how people are treated. Oh, right, yeah. It's totally different. You're viewed differently by everyone. Yeah. So it just made me very more empathetic to people who have disabilities. But it really changed my life because I had to make huge changes in my practice.
You were thinking of finishing the eye surgery, or you want to continue?
Oh yeah, I was going to. Actually, my daughter was going to take over my practice. Okay. She's an ophthalmologist. Yeah, that was what I was going to do for the rest of my life, and I really couldn't operate. I couldn't continue the way I was doing. I also found that I wasn't healing well after. Everything changed as far as the way I felt. And I became a patient instead of a doctor. And the whole experience of being a patient, how I was treated, made me realize you have to greet a patient when they walk in the door. You have to say goodbye. And I also found I saw a lot of specialists. I wasn't a surgical candidate for the pelvic fractures. Yeah. So they dismissed me. There was nothing they could do for me.
They can heal by themselves though, right? Eventually?
Well, they do heal by themselves, but it was such a stress on my body that I just didn't feel well. I started going downhill. I had so many symptoms. I went to see multiple specialists, and no one had anything for me.
Were you doing was there peptides or nutraceuticals?
Oh, peptides weren't around then.
None of this stuff.
So
okay.
I decided, since I was feeling so bad, I did hyperbaric chambers for a week to help the healing. But I decided I had to find a way to help myself feel better. Right. And so I went to Synergenics in Las Vegas and got certified in age management medicine. Mm-hmm. And in essence, that was looking at your hormones, balancing them, supplements, just bringing your body back in balance.
Were you menopausal at this time?
I was perimenopausal.
Oh, wow. You're really going through crazy changes as well. Probably your thyroid wasn't working. And
nothing was working.
Or adrenals, there weren't any because you're so stressed.
Well, after that stress.
Your body, actually, your cortisol would be through the roof for a long time, because if it goes over like 25 or so, it's not even stress anymore. It's your body's just trying to keep up with some pathology.
Right.
Yeah,
right.
Yeah. I'd be like, oh my goodness, there's something going on with you.
After I went through that and I became a patient and I had results and started feeling better, I added that into my practice.
With the system that there was like A4M, before A4M was around?
No, that was A4M too.
It was A4M, okay,
yeah, it was part of A4M. I also began to see our system of medicine, and that there are so many patients that really don't get true help. What happens is there's a symptom, it's a billable problem, a diagnosis, so you have to be sick to really get help. You get a medication, and then you have a side effect from that medication, and there's another medication for the side effect, and on and on and on. And a lot of times, patients will get different meds from different doctors. No one knows what they're taking. It's polypharmacy, and it's not the right way to treat an individual, and our health statistics show it. We are the unhealthiest country in the world, and we spend the most.
Is it actually the worst?
The worst.
I didn't know it was that bad.
Out of 30 civilized nations, we come out the last. We're the worst as far as perinatal mortality, women's health,
I've seen the
dementia. I mean, we're
statistics,
just the worst. Chronic
well,
disease.
the health span and the lifespan is completely diverging now. It's not even close to what it should be. So.
Right. We need more quality in our years, even though we have a lot of years. I always said the system kind of needs to implode before it gets better, because the priority should be the health of the individual and not the profit of the company making the medication or making our food. Chronic disease is our major problem. Heart disease, the arthritis, it's killing us. It's going to bankrupt this country. And it is 80% or more preventable. And that's why I'm so passionate about this, because if a person wants to be healthier, they can make some very simple changes, some more complex added on, but they can reverse the course of their health.
Totally. Even if they have genetics, or their parents, heart attacks, we could have them feeling pretty good. And we can look at some of their genetics too.
My father had a heart attack in his early 50s. Wow. He had 3 heart attacks, had cancer, died from cancer, and my mother had breast cancer. So I know that I am genetically predisposed to a number of things, but genetics are not your destiny. No. They're only about 20-25%.
That's what I saw the other day.
Yes.
I always thought it was more, but
what you eat.
So many people say that that's the problem, so they're starting to think, well, it's got to be pretty big, but they just say it because they don't know how to treat it or they don't know what to look for.
That's kind of
mold. It's got to be mold. I'm telling you. When you don't know what to look for,
Funny
look for the mold.
Say that.
It's like 75% of the time. Even people that aren't that sick, but they're just nothing's working. Oh, it's MTHFR. They're not detoxing. Well, we give them folic acid. We give them everything they need. We give them. We do nutraceuticals. I'm an herbalist. We have peptides. We have so many treatments. If they don't heal, unless they're doing something on their side, they're not telling you. Most of them are honest, and I know they're not. Then we look for mold. 6 mycotoxins, plus the immune system's reacting to mold, and they can do all the brain,
That's one of my
aflatoxins.
specialties.
I love that.
I have so many in Florida. It's a big
You specialize
problem.
in mold?
I do.
You have to, because there's so many people. If you don't get it out, you can't treat the rest of them.
Right.
They'll get stuck. Right. They'll go out of your practice. You will never see them.
But isn't it interesting that very rarely are patients tested for mold?
Getting better. In my circles, there's a lot. So you think, oh, everybody's doing it. No, that's your 7 doctors in your little circle. What about the rest of the world?
Right, right. Well, I do a total toxic level testing. So it's
Vibrant Labs? Use
yes,
Vibrant? Yeah,
yes,
me too.
they're total toxic level.
I do that every day.
And it's so simple. It's a urine test, and it has all the varieties of mold. It has all the heavy metals. You don't just, check for lead, check for mercury. No, you don't have it, you're fine. No. There are a lot of others, especially if you have amalgam fillings.
There's so many different
Cesium, tellurium, there's crazy metals, and they're in amalgam fillings.
Yeah, well, they're in the dye that they put in a lot of times. They're imaging too.
Yes,
which sometimes you want that. I mean, you kind of need it, but once in a while or 5 times in your life, not like every year or a mammogram every 6 months or something. You're just going to irradiate your breast.
Right.
It's craziness.
Right.
Do
well,
thermography.
Your body, it's like, you have this exposome. It's all the toxins you've ever been exposed to throughout your life. Yeah. And then, if you're stressed, your genetic weakness will predict where that will break. Okay. And you'll have a symptom, whether it's arthritis or a heart attack or memory issues or dementia.
The weak part in your body, let's just say, is what's going to come out when the stress just overloads.
Because your body can handle so many things. It's always detoxing. But if you have a deficiency in your detox genes, and there's, over 15 of them, very many, then that's where it's going to break. Yeah. And you might develop a cancer.
I always ask them, what was happening in your life right around the time you got sick? And a lot of times it's a flu. So there's some weird viral component or something. And then I say, well, did you have a divorce? Oh, my boyfriend broke up with me. It's always this big trauma, or to them it is a big trauma.
Right.
That's going to the body takes a hit. But after that, I don't know exactly the mechanism, but it starts us off on another path. And
well, I always say that every thought affects every cell in your body.
Thank you. Very smart, yeah.
We are one system. You can't break us down into, this is gastroenterology, this is neurology, and it's all together. It works
Coming
together.
from a hardcore surgeon, you guys better listen to this, because this is really this is so true in spiritual healing, and we think of truthfulness, so we think of everything you say, everything you think, and everything you do affects the energy of your cells and the resonation of your cells.
Immediately.
Oh,
Immediately.
yeah.
I mean, you can measure it with HRV, heart rate variability. That's a measure of the balance between your sympathetic and parasympathetic nervous systems.
The nervous system,
So I've got
right.
my Aura Ring. That's something that I use all the time, but even your Apple Watch.
So when you say you use your Aura Ring all the time, and I've done the, I had the watch a while back, a really nice one, and it would tell me when I'm getting depleted. Is that what the Aura Ring does?
It can measure your resistance, your stress levels, but the HRV is part of measuring that. And it is such a great indicator. There's a Heart Math Institute where you can get immediate biofeedback on how your thoughts are affecting your heart rate variability. And it goes into the blue zone, which is very good. Green is okay, and red is bad.
I'd like to do it. I want to send some.
One bad thought puts you in the red zone, like immediately.
Yeah.
It's amazing.
But that can also hurt your body and hurt your cells and hurt your life. But
It
people don't get it.
It does, yes, absolutely. Yeah, our brain is very powerful, and it affects everything in every organ system. Yeah. It's like, 3 pounds, and it uses 20% of our metabolic energy. Well, we have an energy field. We are energy. And our heart energy emits 3 feet out, and it's measurable.
Is that like Carillion imaging? Of like ginseng, you'll see this incredible picture of energy, like blue energy with all these.
Yeah, kind of like that. It's, you talk about
like
the aura,
right?
You talk
imaging.
about that, but this is actually measurable. This is energy, electromagnetic energy.
I can't believe you came from surgery. You go all the way to here.
Well, like I said, I had a pivotal moment.
It changed so much.
And I'd like to share it because as a country, as a world, we need to be healthier. Do you know that 1 out of every woman over 50 will have a bone fracture because of osteoporosis? That's an epidemic.
I didn't know it was that bad, but it's
and a third of men.
Wow,
How about
even
that?
men now too?
And why not do bone scans?
Just
DEXA
do
testing on
bioidentical
everybody.
hormones.
But every cell has receptors for vitamin D, all all the hormones. They affect
Estrogen, women and
everything.
estrogen, so
Men and
powerful
estrogen,
for their
yes.
brains.
Yes.
And they can't think if they don't have estrogen. I've seen it in action with a
Right.
doctor, actually.
Oh, yeah, but absolutely. You have to have it. Your body is like a symphony. You have to have everything.
Well, but we treat it like chopsticks.
Right.
I don't
right,
mean
that's right.
like the song Chopsticks.
Right,
Yeah.
Yes.
That's terrible, I know. You're totally right. So you're still doing the eye surgeries now?
Oh, no.
Okay, so you're just doing
really,
functional, regenerative, and aging, right? You can marry those 3 together.
Precision longevity medicine.
Call it, there's all these
That's
new names.
Right. I know, a lot of names.
I don't know what they are.
I was saying functional medicine. I found no one knew. Well, what's functional medicine?
Do you know precision longevity?
Kind of more.
Okay.
Yeah, longevity.
All right, I'll start using that from now on. I think that's what that's all.
But I do very specific testing. Doing a full history of a patient, review of systems, a genetic profile using AI that gives a person an idea of genetically what they should be eating.
Weak spots?
Well, the weak spots, but it gives actionable information on what you should eat, what exercise you should do.
Better than allergy testing, like IgE, IgA,
It's not
IgG?
allergy testing.
But is
it's
it better
for
than
metabolic balance. It's better than that, I think. I mean, if I just had mine done, and if I had known what I know from this test in my 20s, 30s, I've had knee replacements because I ran for years and years, and my knees always hurt, kind of ran down my cartilage. And that was one of my main genetic deficiencies.
Okay. So you've been swimming in a pool instead of running on the pavement.
Well, my exercise should be more weight-bearing.
Or elliptical or whatever.
Weight-bearing. Weight work. That's what it said, yeah.
You need to tell me that. I think I'll start using it.
That's a very cool test. But that, combined with actual lab work and doing micronutrient profiles, the total toxic levels, looking at inflammatory markers. And then one of my pet peeves is that people think that if their LDL is okay, they're okay, and they're not going to have a heart attack.
What about SDLDL? And all the inflammatory markers, like 7 different ones.
The number one indicator of a possible arteriosclerosis and heart disease is particle number, LDL particle number, and oxidized LDL. So you can have a normal LDL, which is actually, I've had that, and I've been told for years and years that everything's okay until, well, I had a mold issue actually, and sinus problems, and I had a CT scan done, and a plaque was found in my carotid artery. But my cholesterol was always fine. My LDL was fine.
It's not cholesterol. It's the inflammatory markers.
It's the advanced lipid profile. You have to look at that, and it's just as simple to get that. A couple more, factors, and you have an idea of your risk level. It's so important.
Well, we always look at the arachidonic acid, the EPA, the DHA. We look at all the things they're eating, what fats they're eating.
Yeah, the micronutrients
levels. I mean, we use Cleveland, sometimes Boston. We get a lot.
It's readily available,
10 pages. It's like
but not done. In fact, I have a patient who has a stent, has a cardiologist. The cardiologist has never done the advanced lipid profile.
There's only a few. You find some good ones. I refer once in a while.
But that's why we're here.
Yeah.
Spread the word.
Right. People got to know all this stuff.
And patients might be their own advocates and ask for that. Just ask for an advanced lipid profile. You know your risk for the #1 killer in this country. Too many women and men are dying.
Well, we want C-reactive protein, we want MPO, we want LPPLA2, we want little a. We want at least 5 inflammatory markers,
right.
At least.
Right.
But there's ways to get this out. We have plaque X IVs, phosphatidylcholine. Then we used to do plaque X and we do chelation. You do like 5 to 10 of those. You're going to strip a lot of plaque. You're going to even pull fat out of the liver. So there's and it's not that difficult. And it's not even that expensive.
I know.
It's going to stop them from having a heart attack, a lot of these people.
Right. Instead of having very expensive stents or open heart surgery.
No, you don't want to end up in a hospital because
you can prevent it.
It'll take you a year or more, if you know how to do it, to detox just from that one surgery in the hospital because of the chemicals they put in your body.
Exactly.
And if you're sensitive, then you're going to get an autoimmunity, then you're going to get all these different things. It's going to be just straight downhill. Unless you find someone like us that can say, oh, did you go to the hospital? Did you have surgery? Like, oh, yeah, that was like 2 years ago. Okay, well, let's do some labs. Let's see what's going on.
Well, like you were saying, detoxing. But detoxing means so many different toxins that we're exposed to. Like I was saying, that exposome, everything that you've been exposed to till this point in your life. And that goes into what creams you're using, the water that you are showering with, what you're drinking. The plastic cups on hot coffee cups.
Oh, yeah, that's good.
You're drinking plastic. So we can measure
now
plastics in the
have become
body,
a big deal too.
Parabens, phthalates. You can measure all the heavy metals. You can measure environmental toxins, gasoline additives. Almost all my patients have gasoline additives.
I had a gentleman, he was coming for ED, and there was no erection. He was 60 or so. And we tried testosterone. Most of the guys you give them testosterone fixes 50% at least. Nothing, 0. Anatomically, he's fine, And so we did a big environmental screen, right? And he was a crop duster. He used to be when he was younger in Ohio. So crops, right? He flew a lot of planes, breathed in a lot of crop. So I was thinking, oh yeah, that's what it is, right? No, all those numbers were normal. It was the gasoline derivatives. So I asked him, did you ever work on cars? He goes, oh yeah, when I was doing the crop at the same time, we'd build cars in the garage and we wouldn't have anything piping out the exhaust. It was too cold. We didn't want to let the cold air in the winter. And they're just breathing in the exhaust for years and years and years. And that's what it started fixing those, pulling some of those out, glutathione doing things. Yeah. And what do you know? The guy's he's doing well now.
Yeah.
So it was just that needle in the haystack.
Right, you have to look.
We didn't know. You have to look. If you're not looking, you're not finding. Patient's just going to bounce around. Oh, your testosterone, you're getting like 2 cc's of testosterone recipient. All his blood cells are completely, black blood, thick blood now. He's candidate for a heart attack because nobody's monitoring that. Oh, just keep him more No, it's not testosterone. I've been, the last month, for whatever reason, I've been saying you don't know what you don't know makes you stupid. And if you don't know what you don't know and you think you know, you're in trouble.
Right.
You got to be so careful, because
so many things in our environment, so many of these toxins block your hormones from working. So you might
Endocrine
be taking
disruptors.
Endocrine disruptors. They block the ability for the hormones to work, and everything gets clogged up. But there are ways to get it out of your system.
Oh, yeah, yeah.
And first you have to find the source. Like if there's mold, you have to find, is there water damage in your home, and repair that. But then there are ways to remove mold from your body, but it's stored in bone and fat. So it takes a while to do that. And there are herbal ways, there are medical ways, but it's something that you have to be committed to. It's not a
so
one and
simple.
done.
Yeah, mold's not simple. You got to keep up with it, definitely.
Very, very prominent. And it's like the great imitator. Like syphilis was called the great imitator. It can present with so many things, but it can present with fatigue, with arthritis, with sinus issues, you name it, hair loss.
So what do you want to do when you grow up?
Well, I really don't want to grow up.
Good. Just keep doing what you're doing. You're on a great path. Just keep learning, conferences, going around the world.
I'm doing a lot of conferences. I'm on the Lumati board that Jackson Corley is working with as well. And I'm Ukrainian. My background's Ukrainian, and I have a Ukraine Crisis Relief Fund. I have raised $1.5 million that has brought over portable generators.
Does it get to go where it's supposed to go?
Yes, because I'm in control of it.
Are you going? Are you bringing this stuff over yourself, or?
Well, I have people that I talk to. We FaceTime or have
Good heart people.
WhatsApp.
They're trying to help.
Good heart people. Okay. I get a video of the people on the front lines that get the portable generator, and they say, "Oh, дякую, Dr. Lyda," in Ukrainian. I have hundreds of videos, and I've sent over ambulances, 5 ambulances, medications. I have met the ambulance driver of one of the ambulances that saved over 200 Ukrainian soldiers. So
thank you.
I have connections with great groups in Ukraine, and I'm going over, I think, in June. Oh, I do want to tell you something that's new in my practice, and it's called, I'm taking an MIT course right now on AI. It's fabulous. It's blowing my mind.
Is it more than just marketing?
It's not marketing at all.
What's it for, AI?
It's about AI, how it started, understanding large language models, how to use it. You have all these projects you do, and it has really just enhanced the scope of everything. I use ChatGPT 10 times a day, minimal. It's like a friend.
Like for what?
Well, as an example, one of my projects was learn a new sport, or use AI to help you describe a new sport. Well, then I decided, I'll use this for my practice. It'll be about pickleball. I love pickleball.
Yeah.
It'll be about pickleball, and I'm going to have a PDF, a paper with my letterhead, right, and have it for my patients. So I told ChatGPT, I'm a physician. I want to write this for my patients for them to learn a new sport and be healthier. I want to know the history of it, all the rules, all the gear that you need, where to get it, where can you play in Tampa, where can you get lessons, and give me a map and give links, for all the places that you can go or get a lesson. So it generates this whole thing. And then I said, I need my letterhead, put my letterhead on it. And it goes, would you like a PDF version as well? I said, yeah, that's a good idea. And then it comes back, and I call him Einstein, ChatGPT.
Einstein.
I say Einstein.
Oh,
I went to Einstein Medical School. Then it goes, would you like me to generate a link for your patients with the PDF on it? Well, I didn't think of that.
For your website, or just some link?
For my website. Yeah.
Oh, now I'm starting to see the utility of this thing.
There's a better way. And now I use it all the time. But I have to tell you one thing that I'm so excited about, and I've invested in this. It's coming out next week, and it's called AI Me. It is an app that uses your phone for facial recognition and retinoscope to tell you your blood pressure, hemoglobin A1C, glucose, oxygen, stress level, and just with a facial scan, and you have to do 3 days in a row, and then it monitors. And so it's a screening tool, but you get things like hemoglobin and hemoglobin A1C.
I hope that doesn't get in the wrong hands, because that could be used very
Well, it's being
detrimental.
marketed to big companies that want to help screen their employees to see doctors.
Right. But think about the repercussions. To all these people have high blood pressure and everything, they have pink slips next week because they're a liability to the company.
Oh, I see what you're saying.
It can be used really in a horrible
Yeah.
way. But I love it for like my patients. But get out in the insurance companies or something. Oh no, we're not. You can't sign up for it. Sorry. Anyway.
Yeah, you have to. The data has to be protected.
Yeah, but
Yeah,
did
but
that
I know what you're
so
saying.
23andMe. They're getting
They
the
gave
thing
you
that-
no useful information.
Luckily, I never did it, but they're telling everybody to do it because it went bankrupt and all this stuff's going to be sold or something. You can go and delete. You better go in and
You have
delete
to
your
go and
stuff right
delete
now.
your stuff,
Yeah, but who
right,
would have thought?
right.
Why would you want to do that? Why do you have to do that?
Right.
So
right.
crazy.
Because everyone wants to monetize whatever they can monetize.
Well, they want to monitor you. They all want to monitor you.
But that's monetizing you and your information.
Or not, yeah. It's pretty
Well, we
insane.
are of the same mind.
I'm so glad you came all the way. Thank you for joining today. It's been
Oh, it's
wonderful.
really my pleasure.